Hi, everyone. Nice to see you again today. Thank you for joining me for part 3. This is our third and final session of the ICHRA webinar series. So today we're going to unpack the complex but critical compliance landscape surrounding ICHRAs. This is me. This is my contact information. So if you do need to ask me any questions, want me to work on an ICHRA proposal for you, please reach out to me and I will be happy to help you. Just some general housekeeping. We will do a Q&A at the end of the session. If our session does go over an hour, we will make sure to, I'll continue. I do have some time after an hour. If you need to come off, that's fine. This is recorded. And then, as always, you can always reach out to me directly for any questions. So what we're going to cover today. So many employers assume that because ICHRA allows employees to purchase their own insurance, that ERISA doesn't apply. A lot of fintech vendors don't have prior group health insurance experience, and therefore they are also in the dark in discussing this important piece when installing their fintech with employers or when advising the brokers or agents. So, but the truth is, ICHRA is a group health insurance product, and it is covered under ERISA, and compliance is essential. Today, we're going to focus on how ERISA, COBRA, HIPAA, and ACA reporting obligations apply, and what that means for employers, for brokers, and administrators. So if you're working with ICHRAs or advising someone who is, these are the core compliance pillars that need attention. So we're going to start with ERISA first. So before we dive into whether ICHRAs are ERISA plans, which we actually already told you, we're gonna ground ourselves first in what ERISA Title I actually requires. So Title I establishes basic protections for plan participants. That includes the right to receive certain disclosures, rules for claim procedures, and a fiduciary standard requiring employers to act in the participants' best interests. In essence, Title I aims to ensure that employee benefit plans are operated fairly and transparently with participants' interests at the forefront. ICHRAs, being group health plans, fall squarely under this framework. So is an ICHRA an ERISA plan? As I had stated earlier, yes. ICHRA is a group health plan under ERISA. ERISA applies to any employer-sponsored health plan unless specifically exempt. So that would be your certain government or church plans. Since ICHRA is an employer-funded benefit, it falls under ERISA rules. ICHRA is not just a reimbursement policy, it's a formal group health plan under ERISA. That means it's subject to the same Title I requirements as a traditional group plan, including the need for written plan documents and a summary plan description as well as avoiding endorsing specific health plans. I'm going to talk about this again. I have a slide fully on it, but I just really need to make sure that you all are aware the importance of the subject, because we have a lot of pop-up ICHRA vendors that are coming into place and they don't understand these ERISA laws. So agents are being misguided by this. So you need to realize that under ERISA, avoiding an employer, as well as you as the broker, you need to avoid endorsing specific health plans. Employers cannot steer employees toward particular individual health plans or carriers, or the DOL might treat ICHRA as a traditional group health plan, which would violate ACA and ERISA rules. So the employer cannot direct them towards specific plans or carriers, and then you, as well as the agent or broker, you can't do that either. You can't say, well, I really like Anthem, and and Aetna. So I'm only going to tell these employees about Anthem and Aetna. And the employer's like, let's make it easier for them and narrow it down to like 4 plans. You can't do that. That violates everything under what an ICHRA is. And again, like I said, we will go over that in another slide as well, but I really want to make sure that everyone on this webinar understands the importance with that. All right, so required ERISA documents. Employers must comply with several ERISA requirements, including having a written plan document. A written plan document defines how the ICHRA works, who is eligible, and what's reimbursable. If you make changes, a notice of material modification must be provided. An employer must provide an SPD. Employees need to understand their benefits, and ERISA requires employers to give them a summary of the plan. You will want to keep all the documents on file for 6 years. Follow compliance rules for HIPAA, COBRA if applicable, and ACA affordability. Even though ICHRA is flexible, it's still subject to many regulations. ICHRA notices. So the DLL requires a specific notice to be provided each year to employees who are eligible for an ICHRA. The ICHRA model notice is important because it informs employees about their employer's offer of an HRA, and it explains how it may affect their eligibility for premium tax credits on the health insurance marketplace. It also provides crucial information that the marketplace needs to determine eligibility for advanced premium tax credit payments. And as you're aware, if you've been on the other parts of my webinar, not everyone's going to be eligible for those premium tax credits, only if the employer has made the ICHRA reimbursements deemed as unaffordable per the ACA guidelines. We'll review that in a minute as well, just to make sure you remember what that affordability formula is. So this notice, this ICHRA notice, it must clearly outline what kind of coverage they need, what happens if they opt out, and then make sure that the timing and the content that are in the notice are correct. So now we're going to talk about COBRA. COBRA is an important piece, and it does apply to ICHRA. So if the company is subject to COBRA, which means if the employer has 20 or more employees, the ICHRA must be offered for continuation. Now, the individual health plan is not being offered, the ICHRA reimbursement is. So that means the employees can continue receiving the allowance for a certain time, and they may have to pay the full cost of that allowance plus a 2% administrative fee. So let's talk about an important nuance between HRA COBRA and ICHRA COBRA, because it does not operate the same. So with a traditional HRA, the employer must continue making the HRA contributions during the COBRA coverage period. The employee pays the COBRA premium up to 102% of the employer's cost, but they can continue to access those HRA funds as usual, and they do not reimburse the employer for those HRA funds. Now, that's a traditional HRA. So in contrast, with an ICHRA, COBRA applies only to the employer's allowance. So to continue receiving it, the employee must pay up to 102% of the allowance back to the employer. So essentially reimbursing the employer for continuing to provide the HRA dollars. So if the employee doesn't pay, they don't receive the ICHRA allowance during COBRA. So that's especially important for those that are familiar with the traditional group health world and how HRAs work under COBRA in a traditional traditional group world. So ICHRA COBRA does operate a little bit differently than the traditional HRAs. So definitely study up on that if you do have some confusion. But the ICHRA contributions, the ICHRA allowance, will have to be reimbursed back to the employer. So it doesn't make a lot of sense. Most employees are not going to take COBRA under ICHRA because they're actually going to end up paying 2% more than if they were to just continue their individual health insurance plan on their own. They would just change out their bank account information to their own and just pay it fully each month. So that is going to save the employee, in the end, money 2%. So ICHRA is not going to happen. COBRA is not going to happen under ICHRA. I can't imagine any employee accepting it, but we still have to administer COBRA to those employees. They're still going to have that initial COBRA notice and the notice of discontinuation. So they still have to follow all the guidelines that COBRA has in a traditional world. It's still going to continue with an ICHRA. It's just that employees aren't going to accept the COBRA ICHRA. So HIPAA is also going to continue to have a place here. So the Health Insurance Portability and Accountability Act is crucial for protecting individuals' privacy and ensuring the security of sensitive health information. Even though employers aren't paying medical claims directly, the HIPAA still applies. So the employer must avoid seeing employee health details. This is another reason a third-party platform or TPA is always highly recommended. So, fiduciary responsibilities. As a plan sponsor, the employer is a fiduciary. This means that they are legally responsible for acting in the best interest of their employees. They need to ensure vendors are credible, notices are accurate, and funds are handled properly. That is on the employer as they are the fiduciary. So let's talk about Form 5500 requirements. So this applies to our plans that have 100 or more participants. So the Form 5500 is a comprehensive reporting requirement under ERISA for group health plans. So that includes ICHRA. It's primarily required for plans that cover 100 or more participants, but also applies to certain smaller self-funded arrangements. For most small employers, Form 5500 may not apply. However, all ICHRAs are considered self-funded group health plans. So even though employees are using them to purchase individual health insurance, the ICHRA itself is a self-funded group health plan. So this classification is going to trigger certain ERISA compliance obligations, including the potential requirement to file the Form 5500. Form 5500 is required if the ICHRA covers 100 or more participants at the beginning of the plan year, unless the business is an exempt status, which would be, again, government entity or a church. The count includes both the employees and their dependents. So it's not 100 or more employees, it's 100 or more participants. So spouses, children, those are all going to be included in that 100 count. Solo owner plans or plans with fewer than 100 participants may be exempt, particularly if there's no wrap plan involved. If you do have a wrap plan, then the 100 count is going to count all those plans under the wrap. So maybe your ICHRA doesn't have 100 participants, but if it's under a wrap, then you have to count dental and vision as well. So everything's going to be counted that's under their wrap when you have that wrap document. So just keep that in mind when you're helping an employer determine whether they have to comply with the Form 5500. So you'll need the employer will need to submit financial, participant, and vendor information. And don't forget, missing the filing can be very costly. I put the costs there on the slide for you, and daily penalties. So those will add up quickly. So always confirm if you're exempt or required to file. And if you do have to file an extension, you can use IRS Form 5558. So very important and costly requirement. So the next thing we'd like to discuss is PCORI. So PCORI is kind of kind of newish. It's not really new, but it came out, along with the ACA. So in addition to Form 5500, employers with ICHRAs must pay the PCORI fee. So PCORI stands for Patient-Centered Outcomes Research Institute. So this fee helps fund comparative clinical effectiveness research, and it's assessed based on the number of covered individuals in the plan. So again, not just employees, but all participants, each belly button. So the amount does change slightly each year. So always check the IRS website for the updated rate. The fee is reported on IRS Form 720. It's due each year by July 31st for the previous plan year. It's not a whole lot of money. This year it's $3.47, but it is a requirement that we want to make sure that we're letting our employers that we're working with know that they need to pay this. And this PCORI fee is not just for ALEs, it is for all sized groups. So ACA reporting requirements. If you're an applicable large employer, so ALE, so again, ALEs are 50 or more full-time or full-time equivalent employees during the previous calendar year, then they're going to be considered an ALE. So offering ICHRA satisfies the employer mandate to offer minimum essential health insurance coverage to their full-time employees and their dependents, but only if it's affordable. So one of the forms that's required is the Form 1095-C, just like a group plan. So when an employer is putting together the 1095-C, they're going to use the lowest cost silver plan to determine in the employee's rating area, to determine the contribution for line 15. To determine affordability, the ACA uses a specific formula. So I know I've gone over this multiple times. We're going to talk about it again. So the formula is the employee's monthly premium for the self-only coverage on the lowest cost silver plan. After subtracting the ICHRA allowance, it must not exceed a set percentage of their household income. That percentage does change from year to year. This year it is 9.02% in this year, 2025. So if it does exceed, the ICHRA is considered unaffordable and the employer may be subject to penalties. So again, this is only for those ALEs, so for those large employers. So remember, you're going also, when determining that formula, it is not based on what the employee has chosen for their plan. It is based on the lowest cost silver plan available to the employee on the exchange in their area. So it doesn't matter what they've chosen, determining affordability is based on that lowest cost silver plan. Okay, so this is a hot topic for me because I see the ICHRA being talked about not necessarily in a compliant way. And, I talked about this before, so this is an important slide that I really want to focus on. So ICHRA regulations prohibit employers from endorsing or steering employees toward specific individual health insurance plans. That means you can't say, we recommend X plan or direct them to a specific carrier. The IRS and DOL made this clear in their guidance. Violating neutrality could jeopardize compliance with the HRA safe harbor. So if you're using a platform, make sure it presents a broad, unbiased set of options. So why can't an employer recommend a specific plan? So one, it's going to not comply with ERISA compliance. Recommending specific insurance plans could make the employer's ICHRA arrangement subject to ERISA plan sponsorship rules, leading to additional regulatory burdens. Also, maintaining employee choice. ICHRA is designed to give employees full autonomy in selecting their health coverage, reinforcing the principle of consumer choice. Avoiding liability. If an employer recommends a plan and it does not meet an employee's needs, the employer could be held responsible for misguiding the employee. And that could have some legal ramifications. So we want to, the employer needs to stay out of the picking process. That is, again, one of the huge benefits of having an ICHRA for the employer is that they don't have to worry about deciding, 1, 2, 3 plans for all their employees. They stay out of that process. Their focus needs to be on the contributions, the budget. That's what they're focusing on. Leave the employees to make those choices. As a broker, you need to make everything available to the employees. Yes, you're going to narrow that down so that it's not so confusing for the employee, but you still have to let them know, hey, there's 7 different carriers available. After talking with you, and I looked up your doctors that were in network, there's only 2 carriers that have your doctors in network. Now we've narrowed it down to, 20 plans. Still way too many. But talking to the employees, looking at the budget, looking at what the ICHRA contribution is going to be, you're going to narrow that down even further for the employees. So the employee isn't going to have to dwell over, 120 plans or whatever it may be. You are going to narrow it down, but you're going to narrow it down by the employee's needs, not by you, the broker, trying to make your bonus with and better, or you maybe aren't, not certified, but appointed. You're not appointed with CareSource, so you're not selling CareSource, or you have Molina, you're like, well, they're on exchange, I'm not going to offer on exchange. You need to have everything, let the employee know what all is out there and the implications regarding that. So you as the broker, you are narrowing it down for them, but not by what's in your best interest or what you're more comfortable with. It's about what's going to be best for that employee. And if the employer comes to you and says, well, I want you to make it easier for my employees, and I only want you to offer them 4, you need to let them know you cannot do that. Or now they are now a traditional group plan, and they have to comply by those ERISA guidelines, and individual health insurance plans do not comply with ERISA. And that's fine. It's okay under the ICHRA final rules, but the employer needs to stay out of that whole process. So what can employers do instead? So employers should focus on educating the employees about their options without influencing their selection. So they can provide general education materials. They can share neutral resources such as the healthcare.gov. They can host informational sessions, so they can arrange sessions with you, the broker, to come out and talk to the employees. They can use the TPA to assist employees in navigating the health plans. And then they can also just guide the employees to government sites, to either the state-funded site, if it's a state-based exchange, or, like I said, healthcare.gov. But they need to stay out of you should just do Anthem. Just stay out of that narrowing down choices for the employees. So ICHRA is subject to non-discrimination requirements, which non-discrimination requirements prohibit favoring highly compensated employees with richer benefits or broader eligibility. If you're only reimbursing executives, you're likely out of compliance. If a self-insured health plan fails the non-discrimination test under Section 105H, the highly compensated individual participating in the plan will have to include the value of the excess benefits they receive in their taxable income. They're not going to be very happy if they have to do that. So to avoid violations, stick to the allowed employee classes, which we went over in Part 2. There's 11 allowed classes. If you did not see Part 2, we have that recorded, and we'll be sending out links as well as to the recordings. So definitely go back and watch Part 2. It does go over the different allowed classes. And then you want to apply your allowance structure consistently within each class. The ACA also included non-discrimination provisions for the fully insured plans, but the enforcement was delayed and it's never been picked up. I don't know if it ever will, but there is that enforcement for self-insured plans. Minimum value requirement. So ICHRA plans are not held to the same minimum value standard as traditional group health plans. Instead, they only need to make available coverage that qualifies as minimum essential coverage. And ACA individual plans do meet those MEC requirements, and that is why ICHRA is an employee cannot enroll in a short-term plan or a health share ministry plan because those do not meet MEC. And so that's, ICHRA only has to, like I said, meet the MEC. Traditional plans, so traditional group plans, they have to meet both MEC and minimum value to avoid penalties under the employer mandate. So minimum value means that the plan covers at least 60% of the total allowed costs for a standard population. And just as like an FYI, just if you were wondering, the silver level plans on the ACA, those often closely resemble minimum value. So although employees under the ICHRA are not required to enroll in those plans, but just so you're aware, but ICHRA only has to meet MEC. It does not have to meet minimum value. So avoiding compliance pitfalls. So these are the most common compliance mistakes we see. Again, excessive employer involvement, which is why I focus so heavily on it, because it is a common compliance pitfall that I'm seeing as these ICHRAs are skyrocketing. So let's try and nip it in the bud now, make sure that you understand that that is not a compliant way to be administrating the ICHRAs. Employers sometimes help employees shop for individual plans or only offer one or two carriers, but this again can make the ICHRA look like a traditional group health plan. Employees must have the freedom to choose any individual health plan that meets the minimum coverage requirements. Restricting choice to specific carriers could make the ICHRA look like a group health plan, which could lead to compliance violations. Employers must remain hands-off regarding employee plan choice in order to stay compliant with ERISA as well as ACA rules. So make sure you're not assuming that the ICHRA it's not a casual reimbursement policy. It is a regulated plan. So you want to get the documents right. You want to protect data. You want to ensure that there's no employer involvement in individual plan choices. And as an agent, you want to make all the carriers and plans available and double check affordability if you're working with a group that is an ALE. So if an employer makes these mistakes, they could face ERISA penalties and even lawsuits. I try to put all the penalties on each of the slides. So if you are wanting to re-review those, you can kind of look over those. So best practices for compliance. The simplest way to reduce compliance risk. Use a professional platform or a TPA that handles documentation, notices, and substantiation, and always consult with legal and accounting professionals when designing or modifying your plan. So to avoid the pitfalls, here are the best practices every employer should follow. So maintain clear documentation. Have a formal ICHRA plan document and update it annually. Distribute required notices. ERISA requires that employees receive clear communication about their benefits. Educate HR and employees. HR teams should understand why they can and what they can and cannot do under ERISA. Stay neutral. Employers should not guide employees to specific plans or insurance carriers. Partner with professionals. Compliance can get tricky. So working with a qualified health insurance agent who has in-depth knowledge of required employer-sponsored health plan compliance is key to making sure that you're staying compliant. So to wrap up, ICHRA is a flexible and modern plan, but it comes with traditional compliance regulations. So ERISA, HIPAA, and COBRA don't go away just because you switch to a reimbursement model. So the Cornerstone solution. So what do we do to help keep you and your employers compliant? Well, we work with multiple payment platforms, ICHRA vendors, as some might call them. So what the payment platforms do is that they are going to pay all of the different carriers that the employees have chosen. So if you have a population of 20 employees and there's 11 available carriers, maybe you have a plan with each 11 of those carriers when you have spread it out over those 20 employees. So that payment vendor is going to pay all 11 of those carriers on a monthly basis for the monthly premiums of those employees, and then they are going to give your employer one invoice of all those 20 different premiums that they've paid for that month. They're going to give that to the employer into one invoice, and then the employer is going to pay that invoice to the payment platform, and then any portion that the employee is due, so the premium minus the ICHRA contribution, now the employee owes that amount can be taken out of the employee's paycheck. So it financially it's going to feel very much like a traditional group health plan. If there's a Section 125 in place, the employer can take the employee's portion out of their paycheck pre-tax. And also that is if you have done the enrollment off exchange. We've talked about this in prior webinars, but in order for the employee's portion to be taken out pre-tax, the enrollment, the individual enrollment does have to be done off exchange. So that means direct through the carrier site. So as a broker, you have a broker portal. Within those broker portals, you have links to do off exchange enrollments. If you do the enrollment through Health Sherpa, you most likely are using on exchange unless you've toggled. The right-hand corner of Health Sherpa is a toggle for off versus on. However, unfortunately, Health Sherpa currently only has 2 carriers on that off exchange platform. It's Ambetter and United Healthcare. So any of the other carriers, you do have to go direct to their site to do those enrollments off exchange. However, especially in the state of Ohio, and there are some other states as well, there are a couple carriers that do not currently this year have off exchange enrollments available. So if that looks like that's the best carrier for that employee, you still want to go ahead and do that enrollment. You just want to make sure that you let that employee know that, hey, unfortunately with this carrier, the way we have to do the enrollment, your portion can only come out post-tax, and then let them decide if they still want to continue with that plan. But you still want to make that available. But if you are, let's say you're doing enrollment with Medical Mutual, they have an off exchange platform. So you want to do that enrollment off exchange if it's available with that carrier, so that the employee can take the full tax benefit of having the ICHRA. I will also state, and I know I've talked about this in other webinars as well, but I just want to make sure you are aware that carriers off versus on, some of the carriers, the premiums will be different and the plan options will be different. So if it looks like the employer you're working with, that carrier looks like it's going to be a good fit based on their doctors that they have in network, you want to make sure you're running quotes off exchange so that you're getting the correct information to that employee. So for instance, I'll let you know, so Medical Mutual, their silver plans they have more available off exchange versus on. And then let me see, Anthem is pretty much the same. I think they might have 1 or 2 that are extra off exchange than they have on. Ambetter has vast difference off versus on. They have a lot more plans available off exchange, and the premiums, based on where you're at in the state, premiums are very competitive with the off exchange versus on, and the plan designs sometimes look better as well. So you just want to make sure that you're checking out those off exchange plans. They are not exactly the same off versus on. So with our payment platforms that we partner with, they also are going to provide reporting that employers are going to need in order to file those PCORI fees, the 1095Cs, the Form 5500. So these payment platforms that we work with are going to provide the information that the employers need in order to stay compliant. So that's another reason that we really want to have that payment platform, the ICHRA vendors in place, helping us along to make sure that we're helping the employers stay compliant. All right, and then also these payment platforms also generate legal documentation. So they're going to have the ICHRA notices. They're going to have that in a compliant, with all the compliant information that we need. They're going to have your plan document, your SPDs. So that is a very important, again, important pieces to make sure that we're staying compliant, and these ICHRA vendors, these payment platforms, are providing us with that information. The ones that we partner with do. So very important. All right, so what can we do as Cornerstone? Not only are we bringing along these payment platforms that we've partnered with, we want to basically fill in the gaps that you may have. Maybe you run across an employer that has multiple employees in multiple states and you're only licensed in one or two of those states. We don't want you to turn that prospect away. We can go ahead and write for those states that you're not licensed in, and then we would give you a referral fee essentially because unfortunately we would have to keep the AOR on those employees because you didn't write it, and that's just the way the carriers work. But we're partnering with you, so you're not losing that company, you're not losing that business, you're not losing that relationship, but you would get a percentage of that commission for life of that policy. And we've taken care, that you are working with people who have taken care of your clients in a very great manner. And then also, again, we're going to be right alongside you and helping to make sure that your employers are compliant and that you have the information as well as the employers of when they need to file something, what needs to be included, sample forms. So all of that is something that we're assisting you with as well. If you need me to meet with a group with you to go over ICHRA and how that works, I will go out in person with you, a Zoom call, a phone call, whatever way works best for you and your employer, we're going to be there for you. So even if you're not fully confident in all the little details that are involved with ICHRA, you have someone on your side, on your team, that is able to go over all the little details. The other thing is that my team and I are going to be creating proposals for you. So if you have a prospect, we just need 3 pieces of information essentially to put a proposal together for you, because that's going to be the biggest selling piece, is the real numbers, the comparative numbers. Compare an ICHRA to the individual traditional group plan that they have right now. So if they already have a traditional group plan in place, the only thing I would need is their last renewal. If they are like a non-renew, then just whatever that renewal was before. And that's, again, just so that we can provide real numbers and comparative numbers, and also so that we can see what plans they currently have, so that when we're looking at plans to compare, we're comparing something comparative. And then a census template. Census is just going to be like first name, last name, date of birth, gender, the zip code. The one thing that will be different with an ICHRA census template is that we also need county information, because in the individual market, plan premiums change based on county. So that's a very important piece of the census. And then also, it's not a requirement, but if you include the salary information of each of the employees, then we'll also check affordability as well. And then the other thing is contribution strategy. So what do they currently contribute towards their employees for those health insurance premiums? Do they give money towards children or spouses? Is it a different amount than the employees? So the breakdown of that. If it's a virgin group, then the only thing we would need is a census. If it's a virgin group and they've kind of talked about their budget, then that's great to have as well, so we can put together a couple different contribution strategies for them. And that's really the only three things I need for a proposal. So that's going to be really the first step, because we want to get that in the employer's hands, so that when we do meet with them, they kind of have something to look at. Now, obviously, we can have meetings before the proposal, but if we're able to do the proposal first before the meeting, I think that's a little more effective and a better use of time too. So whatever works best for you and your employer. And then let's see, so what's next? So here is a QR code to watch the recordings of part 1 and 2. I've also created a compliance checklist that you can download and have access to. And then, just reach out to me for, one-on-one ICHRA strategy support. And I do want to state, I've had a couple emails from my other webinars that some brokers have reached out and said, okay, I want to do this. How do I get certified? There's no certification to enroll in ICHRA, or to start selling ICHRA. Let's say you're a group health insurance agent, you don't have that individual experience, we'll help you with that individual piece of it. If you don't want to write the individuals, you want to stay in your group health insurance lane, that's fine. That means you have all the compliance stuff kind of down, and then at that point, we can come in and write the individuals for you. Or maybe you're an individual agent, but you don't have that group health insurance experience. That's fine. We're going to help manage that group health insurance piece of it, the compliance and working with employers. So we're going to, again, fit your gaps. There's no certification for this. The first few that you write, it is going to feel a little scary, but don't be scared, because I'm going to be there holding your hand the whole way. So you'll be fine. You'll be great. Like I said, proposals are really the first thing that we want to do. We want to get that. That's going to help make the picture a lot more clearer for you as the agent, but also the prospect that you're working with. All right, so now we're going to open the floor to questions. Please write them in the box. And let me get to my questions here. So I've heard that because the ICHRA is considered a self-funded plan, the COBRA is required even for under 20 employees. No, COBRA is required for 20 or more employees. All right, hold on just a second. Okay, so are there any quoting tools that compare all off-exchange carriers? If not, how is it possible for us to offer all carriers? I know. Unfortunately, there are not currently any quoting tools that compare all the off-exchange carriers, unfortunately. So I have heard that there could be something in the works coming up soon, hopefully maybe even for next year, although it's not. I've heard that a couple months ago. I haven't heard anything since. I'm hoping that is the case, but unfortunately there's not. So what I do, and you obviously can do whatever you want to do, but what I do personally is I use Health Sherpa as a basis for when I'm running the quotes. And I look up doctors. Now, we all know that looking up doctors in Health Sherpa is not always accurate. Even looking up doctors directly with the insurance carriers is not always accurate. But I kind of use that as a basis so that I can at least drill down that way as to what carriers are going to be best for that employee. So I'll put all the doctors into Health Sherpa, and then let's say it narrows it down to maybe like 3 carriers, then I will go into those carrier sites and look up those doctors to make sure that is actually, they are actually in those networks. And then let's say, for instance, if and better is one of those, then I don't run the quotes on the on-exchange portion of Health Sherpa. I'll go to the off-exchange and run the and better quotes. Let's say Medical Mutual is one of them. I just go direct to Medical Mutual site and run those off-exchange quotes. I don't run them off of Health Sherpa because, again, the off-exchange quotes are different with Medical Mutual than they are on. So it is a little more nuanced. Unfortunately, ICHRA is blowing up, so I'm sure there is going to be a platform soon that is going to give us the ability to quote all of them out all at once. And like I said, I have heard there is someone that is in the works of creating that. So it's a little more nuanced, but you always want to start with the doctors. Start with who they want to make sure is a network, because that's going to really help narrow down who you need to quote. Now, you still tell your employee, hey, there's 7 carriers, Anthem, Aetna, and Better, Molina, whatever it is. But out of those carriers, I have found that only 3 had all your doctors in network. So here's the quotes for all 3. Let me know if you want to see quotes for the others. But I started out with just those 3. And then always, this doesn't even matter if you're doing on or off, because those network links, those doctor and network links are not always 100% accurate. I always tell the client that I'm working with, check with your doctor and make sure that they're in network with this carrier before we do the enrollment with you, because they're just not always up to date, unfortunately. So we want to make sure, especially if it's really important for that person, that we give them a little bit of work to do themselves, because there's no way you're going to have time to be calling all these different doctors' offices to see if they're in network with that carrier. So kind of say, hey, Miss Jane, looks like Medical Mutual and Anthem will both be in network with your 2 doctors. However, are looking directly at those carrier sites, they're not always 100% accurate. So before you choose a plan, I highly recommend that you call your doctor's office and verify that Medical Mutual individual health insurance is going to be in your network. And then that way that you're kind of covering yourself, that you've given them told them that they needed to check into that themselves as well before you do the enrollment. So it is a little cumbersome to check off exchange versus on, but unfortunately that's where we're at today, but I do it every day, so it can be done. All right, so where do we refer the employee to shop all the off-exchange plans available to them? So you're not sending the employee off to shop exchange. That's what you're there for. You don't want to send them off to a link to look up stuff for themselves. That's overwhelming, that's confusing. So you're the one that's going to help narrow those down. You don't want to send them to a site where they're looking at like healthcare.gov. How confusing is that for a lot of people? Because it's too much. It's too much information. It's too many plans. So you're gathering the information from the employee and you're pulling the quotes after your conversations with that employee and showing them, narrowing it down in that way. So there is no site. Now, if it is a large employer that you're working with, these large payment platforms that we work with do have links to where the employees can shop all of the plans that are available to them off exchange. And in that way, when you're working with the large employers, there's no way you can work with, 100, 200, 300, 5,000 employees all at once. So you're telling them, hey, here's the site, go click around. If you have questions, come back to me. But for the everyday person out there, there's no link for off exchange. It's only if we're working with vendors that have that available to them. And at that point, the employer has said, yes, we're going forward with the ICHRA. These are the contribution dollar amounts that we are applying towards our employees. And then we're giving that link to the employees to go out and look at from that vendor site. is the 20% residual or one-time commission? It's residual. So as long as the life of the policy, so if we're writing the individual plan for you, you will be getting 20% of that for the life of that policy. If someone chooses an off-exchange plan, do they have to go through underwriting for eligibility? No. So all ACA individual health plans, none of them are medically underwritten. So whether it's on or off, there is no medical underwriting in ACA compliant individual health plans. Yeah. All right, so that looks like that's it. So if there are any other questions that come up, please feel free to reach out to me. And then there will be an email sent out with a recording of this webinar for you. And if you, like I said, if you have any questions, if you want to talk about a prospect or talk about how to prospect, we also have marketing materials available to you that you can provide to your prospects, and the ability to watch the recordings will be sent to you as well with links. All right, everyone have a great day.